This meeting is
Hi
being
everyone,
recorded.
thanks so much for joining us today. We had a max registration today, so we have a lot of folks joining us all at once. We're going to give folks a little bit of extra time to join and get settled and work through any technical issues. So we're going to get started at 3:05. I'm sorry, 3:35. So thanks again for joining us. If you'd like to connect to audio via phone, please go ahead and follow the instructions that I'm about to put in the chat box. Everyone will be muted automatically to ensure that we don't have any background noise. So if you have any questions or comments for our presenters and panelists, or if you have any tech issues, please go ahead and use the chat box. We'll go ahead and get started in about 5 minutes. Thanks, everyone. Hi, everyone. Thanks so much for joining us today. We have a lot of folks who are going to be joining the platform all at the same time, so our system might be a little slow. So in order to accommodate folks who are trying to join, we're going to get started at about 3:35. I've placed instructions on how to connect to audio via your phone. If you'd like to do that, and as well as instructions on how to use the chat feature. Everyone will be muted automatically upon joining. So if you have any questions or comments, or you're experiencing any kind of tech issues, please let us know in the chat box. And go ahead and make sure on the to line that it says all participants, so then everyone can see your message. So we're going to go ahead and get started about 3 minutes. Thanks, everyone.
Hello, everyone. Thanks for joining. We see in the chat box that some folks are concerned about sound. We're going to start at 3:35. Hello, everyone. Welcome, and thank you for joining today's Managing Now for a Better Tomorrow. This is Denise Solzbach. I am the director of the National Center at the Institute for Innovation and Implementation at the University of Maryland, Baltimore School of Social Work, and the deputy director of the National TA Network. I am seeing a few questions that I do want to address, and I see our numbers are still climbing. You will not see yourselves on video. The presenters will be the ones shown from their homes, and you will be muted throughout the conversation today. However, we do encourage communication via the chat box, and I see that a lot of you are very good at that. Sarah, has the recording started? Okay, we're going to jump in. We also are going to be tweeting throughout this discussion. If you'd like to join us, please use the hashtags BetterTomorrow and TA Network Talks and tag us at Institute UMSSW. We do hope this conversation finds you safe and well today. We recognize this is a challenging time for all of us in children's services across the country, most especially the families and the youth that we serve. We have created these conversations to have peer-to-peer opportunities for you to talk with presenters as well as one another. And as I mentioned, while all of the participants are muted, we do encourage you to use the chat box to share your thoughts and resources as well as questions for the presenters. When you use the chat box, please select all participants. This will allow everyone to see what you are sharing. And in follow-up to today's discussion, we're going to send everyone who registered, that's 1,000 of you, a link to today's recording, as well as the resources and insights shared in the chat box. As I mentioned, this is very much a conversation today. You will see the presenters, as we said, joining us from their homes, and we're not going to be using a PowerPoint during this discussion. And this series is truly about managing now for a better tomorrow. Together, we are stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. And we do value your participation in today's discussion. And we may especially need your partnership today, as a few of us are having connection difficulties. So if you lose us, please log back in. If we lose you, please stay with us. And if you lose one of us, because that's happened too, the others will cover. We have a troubleshooting team ready to assist with all backup plans, and we're getting pretty good at it at this point in time. So as I mentioned, this is a conversation series during COVID-19. So far, we have had discussions on crisis communications. Those were held twice, on March 25th and March 31st. We had a discussion on in-home behavioral health held on March 26th, and supporting families. Similar to this one today, supporting families received maximum registrations of over 1,000, so we opened a second group up. So we've had two discussions on supporting families, one held on April 9th and one held yesterday. For mobile response, we also have upcoming discussions, one on mobile response and stabilization. That's going to take place on April 16th at 3:30. It sounds like we might have somebody who's not muted right now. We'll also have housing instability and homelessness to be held on April 24th at noon p.m. Eastern Time, and school mental health. School mental health are going to be in a series of two, one on April 22nd that will focus on the well-being of students and their families, and the second on April 30th that will focus on the well-being of educators, teachers, and school administrators. We're also in the planning stages, and we'll be announcing dates shortly for other conversations supporting tribal communities, rural healthcare, and cultural and linguistic competency. If you want to continue to join these discussions, we encourage you to go to our website and sign up for conversations, as well as access resources from prior conversations. Please go to the institute.umaryland.edu/COVID-19. You can also receive our communications if you're not already receiving our weekly TA Telegram with resources. We will post in the chat box how you can subscribe to the TA Telegram. The mention is that you all know today's conversation is on infant and early childhood mental health during COVID-19. We're joined today with our presenters. Kate Wasserman. She's at the Institute for Innovation and Implementation. She is a co-director of our Parent, Infant, and Early Childhood program. She is also a subject matter expert for the TA network. And her and Lauren Rabinowitz, Lauren, I almost got it. They co-lead the TA network's early childhood learning community. In addition, Lauren is with Georgetown University, where she's a senior policy associate and program director for the Center of Excellence for Infant and Early Childhood Mental Health Consultation. Also joining us today is Liz Manley. Liz Manley is a clinical instructor at the Institute for Innovation and Implementation. She is also the lead technical assistance support for many of the sites, both sites with system of care grantees and non-grantees as part of the TA network. And she also leads the clinical and workforce development work as part of the TA network. Dr. Christopher Balanci is also with us today. Dr. Balanci is with the Judge Baker's Children's Center at Harvard Medical School, and Christopher serves as the medical director for the TA network. So welcome everybody, and I'm now going to turn it over to Lauren. I'll start us off.
Thank you so much for that introduction. Can everyone hear me okay? Good. All right. Hopefully we fixed our echo issue. So welcome everyone. We are so excited to have the opportunity to talk with you today. I'm just going to talk very, very briefly about our early childhood learning community because I think this is new for some of you. So just to let you know that our early childhood learning community has been serving the early childhood system of care community for many years. About 2 years ago, we broadened the learning community to welcome members from any discipline, from any grant program, from any role. We have one criterion for joining, and that is to have an interest in supporting early childhood systems. So we have members from a range of local and federal grant programs across the country, and roles include state policymakers, program administrators, mental health consultants, direct service providers, family members, and educators, just to name a few. So operating in the COVID-19 environment has impacted everyone, regardless of role, funding structure, or geographic location. So today we welcome and invite your questions, your considerations, your thoughts, what your worries are. We want to hear from everyone during this time together. Our early childhood workforce is so varied and purposely cuts across the age span and the service setting continuum. So we are really excited to hear from all of you, and hopefully you will feel comfortable using the chat feature, and we're excited to have the conversation. I'm going to turn it over to my partner, Kate, now for a few other thoughts.
Thank you. And we're so happy to see all of you, or have you all join us during this time. We wanted to frame this conversation a little bit. As Lauren said, the field of infant and early childhood mental health is so intentionally diverse. And I've always been keenly aware myself of the beauty of infant mental health in that we are much more adaptable intentionally, just based on the nature of the focus of the work. And this is certainly a time of great adaptation and need. And many of us are having to pivot where our work happens, of course, wanting to think about an anchoring principle in infant mental health, which is that babies and toddlers and young kids are themselves their own individuals, but are only as healthy and functioning as the people that they depend on, right? And so wanting to ask you guys, and we invite you to fill this in the chat, how your teams are pivoting to really do this work through not only tele or other places, but really focusing on how the caregivers are doing, how people are both navigating this new normal and maintaining their own sense of parenting self-efficacy while balancing also all of a sudden becoming a homeschool teacher, though they maybe didn't apply for the job, and managing their own work-life balances, which at this point don't have the benefit of space and distinctions there. So please fill in the chat how you guys are meeting that need to really understand how caregivers are doing. And we want to think about that as a really important piece of infant mental health. seeing some messages pop in, and we'll continue to watch.
You know, Kate's internet has been giving her a few stumbling blocks today, so she's probably taking a look at the chat and seeing that some of you are already starting to let us know your thoughts and feelings. And I see Zoom is popping up as we know that's going to continue. So we're going to keep monitoring that, and we're going to invite Liz Manley to give a few thoughts as well.
Yeah, thank you. I just wanted to take just a minute to say that this is a time of not just challenges, but also great opportunity, right? From, from these type of challenges, we've learned so much about how to engage families, how to bring them to the table and make sure that their needs are met in ways that we hadn't really thought about before, or in some instances we thought about, but had not been able to get access to the kind of technology and to the kind of tools that we currently have. And so I just wanted to put it out there that this is a time to really think about how do we connect? And that's the biggest part. How do we connect? And is the way that we're trying to connect working for youth and families? And if it is, how do we count it? And how do we tell the story so that these tools remain available even after we move past COVID-19? So I just wanted to say that, but thank you.
Thanks, Liz. And Chris, we'd love to hear a few thoughts from you as well before we open it up to everyone.
Sure. These are unprecedented times, and I think we just need to own that. There's no script for what we're going through. And so part of the excitement of this kind of opportunity is we're all learning from each other. And as far as I'm concerned, there's no bad idea. And we should all be exploring how we continue to support families with infants and young children in the best way possible. So I usually ask people to reflect on what was your original goal for doing this work? You know, what is it that you want to see happen? And are there other ways in this new reality we're living in to achieve those goals? And as Liz says, you may find that actually there's some opportunities in this crisis that allow you to do service delivery in a completely different way that might be different or stressful, or there may be some obstacles, barriers. Certainly what I've been hearing in a number of these calls are the technological barriers. So families that don't have high-speed internet access or don't have the technology, computers, et cetera. And how are you overcoming those? How are you working around those? Are you able to do it telephonically? And I don't want to presume, although I think it would be interesting to see in the chat box whether or not people are actually still doing in-person visits and what those are looking like. If you're doing them from a doorstep, if you're doing them from a hallway, if you're going for a walk with a family, are you meeting somewhere while still socially distancing? I would imagine at this point, most folks have pulled back from that because of the potential threat, both for your staff, for yourselves, if you're the provider of this service, or for the families you're visiting. What we know about the virus is that you can be spreading it before you're sick. And so merely checking a temperature doesn't ensure that you're not spreading that virus. And in truth, you may actually have the virus without getting a fever. And so it's quite challenging to think about how to work in the presence of a pandemic. But I think what I've been hearing consistently, because we've done a series of these calls for different workforces, that people are getting incredibly creative in finding new ways of supporting the folks that they're working with. I am seeing that patients are still coming in to some offices. Others are saying no in-person visits, phone calls, Zoom meetings, if they're able. So I think it's a bit of a patchwork, right? Because depending on where you are in the country, you have different exposures to the virus and different recommendations by your governmental leaders. And I think that also provides us some opportunity to think about how we can be responding, because while we're in kind of, I call it the beginning of the end of the first stage of this, and maybe the beginning of the middle or the ending of the beginning, for me personally, living in Massachusetts, we got our shutdown order on Friday the 13th. I remember it very vividly. I started the day thinking one thing and I ended the day completely thinking something else. And it's almost been like that every day. But for the last week or so, I'd say I'm settling into a new normal, and the shock of it all is kind of starting to dissipate. And now I'm trying to figure out, well, what does this look like, and how long of a horizon are we talking about this needing to be, and how do I wrap my head around that? And then how do we get out of this? How do we unsocially distance? How do we start finding ways to be safely together again? And so much of our work is about being together. And so how do we manage that in a way that is safe both for us and for those that we work with? So I'll stop there and just continue to see what's coming in through the chat box.
Thank you so much, everyone, for your comments. I mean, looking through the chats that are coming through, I mean, we are truly seeing everything from a medical social worker that is still seeing folks in the office setting to there's really been a complete, inability to see anyone in person and have switched to complete electronic outreach. So we're really seeing the full range here. So yeah, we are.
Lauren, one question I'm seeing about how different systems have pivoted to provide Wi-Fi equipment for families that need services and don't have access for telehealth, and would be interested to hear. I know SAMHSA gave out guidance that there would be flexibility in certain grants, but we know, as Lauren started off the conversation with, that there's many different funds for the services for our collective group. So how are other agencies or systems allocating or reallocating funds to do that, or partnering with? I know there's a number as well of local grants coming out now.
In some jurisdictions, you can also get a phone through Mass Health, and some of the internet service providers have been actually extending minutes. So depending on what provider you're working with, there are some opportunities for families based on income eligibility to actually receive a phone through their Medicaid system. And I posted a link on the Massachusetts phone access guidance. Liz, you probably know about this too.
Yeah, and I think we actually had some of those resources in the last conversation that we had that we can share. I know some of them were pretty helpful. Folks were even using Wi-Fi via, public places like Panera has made their Wi-Fi access still available for folks if they're driving by.
Another theme I saw way up in the chat now, because it's coming so quickly, but I think it's something that's another key principle of early childhood mental health, was people were talking a bit about both what their teams were doing to outreach to families, as well as what they were doing to support their teams. So thinking about reflective supervision or just, contact and support, because as Chris said, this is uniquely affecting everyone. And so being the holders of the work and also in the same situation. So wanting to know a little bit about how you guys are supporting your teams, and a resource on that related to crisis communication that Michelle Boardman did, we can put the link in the chat here as well, was really around this idea. And I took it to heart, and as I shared with her, I have really disseminated it in conversations I've had throughout the past 2 weeks, is this idea of it's being so important to be part of the conversation with your target population, even if you don't have the right answer, right? But that we can't expect to sort of rally them back together once, as Chris said, we're through the third phase of this, whenever that comes, if we're not sort of part of the conversation now. And a lot of it isn't having the answers, because no one does, but it's just about reaching out and having communication. And I see the link right there.
I'm really amazed by the different the variety of responses coming into this question about different ways to get internet and just the creativity. I see someone just chatted in that someone is working is going to try an infant massage session via Zoom tomorrow, and that is just phenomenal. And I'm super curious to hear how that goes.
Someone shared similarly to that, another national conversation I was on, where a home visitor didn't have a kid, but was trying to on Zoom show how they would do a wrap for a baby with their puppy, right? And that was also a way that she found to be effective, and she found a moment of joy and celebration in her work, right?
Kate and Lauren, this is Denise. We had some questions both from Joe Kloss as well as Amy Davis about resources that are available. So Joe's question was, have there been any exploration of programs to address young children with behavioral health needs now that may be entering their first school setting next fall? And then Amy was asking if there's any programs that can send by mail or through internet resources to help parents with engaging their children through play, giving developmental ages and stages, toys, etc. And we lost Kate again.
Sorry.
I think she is there. I think it's her video that might be. Yeah,
I can hear you guys. I apologize. See, internet is an issue everywhere. So conscious discipline has, I agree, some really good resources. There's a couple of different stories that have been written for young kids about this that we can disseminate. I don't have them on hand right now, but we can pull those links and get them out to everybody that's been on here. And I would imagine a much more will come on board once we know what the instructions are for reemerging with school.
Well, and so I just want to repeat back and make sure I heard the question correctly. I think the first one that you said, Denise. So questions about resources for families that have a young child that might be entering their first or is slated to enter their first school setting this fall. So I think the question is around, are there resources to perhaps help prepare that family and child for that transition? If I heard that question right, that's a great question.
That's correct, Lauren. That's from Joe Kloss.
Mm-hmm. So offhand, I think one theme that keeps coming up and that's crossing my desk and looking through the different channels is how specific the answer to that question might be by district, by program, by county. I don't know if any of our panelists know of something that would be widely available, without knowing where that individual lives or is coming from. Do you know of anything that is available at more of a universal level?
Yeah, I mean, right now what I've seen is a lot of things trying to explain the current situation to kids. And I anticipate as we get to the end of this school year and anticipate the next with more information, and we have more information, as Chris said, about which phase we're in, I think those will emerge quickly. But a really important cohort to think about, right? To go from, this not being safe to go outside or to go to school, and security and safety being such important messages for young kids, especially when it might be their first time separating from home for that long.
And I wonder, just in thinking about that particular question, there's another important level. So absolutely thinking about transitions for children, but also thinking about transitions for caregivers. So that's probably a really significant transition that parent or caregiver is also preparing for, and thinking about a young one going to a school setting for the first time. And perhaps there was some sort of transition plan in place, or something was supposed to be happening over the next several months to help prepare for that transition, which is also now put on hold. So I wonder if that's some of the, that's another layer to that question.
So we'll keep looking for those as well, Joe. Amy has another question about resources for helping parents, and that's engaging their children through play, giving developmental ages and stages and toys, and helping parents work with their children and help their children understand the new normal of COVID-19 and schools closed. So we've posted some resources of some books. What other resources are out there for parents and caregivers?
Yeah, so NAEYC has some great things about explaining this to young kids. And one of the more universal messages I've seen around parenting is the importance of self-compassion during this time. I saw somebody earlier on talk about in the chat that the message to caregivers about their homeschooling in a crisis, they're not homeschooling, right? And so how do we, kind of allow for the grief of the current situation, the stress of, their own transition, whatever it might be, and then managing their child's needs as well. And that's a lot. So I think many of the universal messages that we've seen have really been about that, about helping parents acknowledge that this is really hard, especially when young kids, demand more consistent attention, perhaps, than their school-age peers.
One other set of resources that comes to mind for any of you all that are in the home visiting world and the home visiting community. So a lot of the different evidence-based models at the kind of the national program office level have put together a variety of different resources and ideas, both for how a home visitor might be pivoting to providing services electronically, but for for family members as well. So that's sort of an add-on to the idea about ages and stages. That I think a lot of us have different tools and resources at home that we might not think of as being a tool or a resource. Someone before mentioned, not having a doll to show how to do a wrap, as Kate said, a puppy, or a teddy bear, all sorts of things like that. So I think that the national program offices for the home visiting, the evidence-based home visiting models, many of them have some great resources.
Mm-hmm. I'm seeing from Jessica in the chat talking about doing teletherapy and noticing some children becoming more aggressive and not wanting to engage in therapy sessions via Zoom and acting out towards caregivers. And this can be for a lot of reasons, right? That it can be really confusing for them to pivot to seeing you who they're used to seeing in person on a screen, and having to engage in the hard work of what used to be around sort of the tradition of entering a therapy office and all of the things that anchor that visit. I think first to sort of think about that for your own self-care, that that can be really hard. You can't intervene in the way that you would have if you were in the room. And then I think a lot of it is pivoting to sort of parent coaching in the moment, right? And the importance of spending some of that therapy time, meeting the child where they are, and maybe processing it with the parent instead, to really understand what that moment was like for them. How can they manage their stressor responses? It's hard to engage young kids via teletherapy. Yeah, I mean, I've been talking with colleagues about this idea that I think the sort of birth to 5 mental health population was probably the farthest or most resistant to telehealth prior to all of this, just because so much of the work is relational and quote unquote on the floor with the kids, right? And so I think there's been much more sort of engagement in telehealth previously than now. But I think as Liz started with this idea of trying to see this as an opportunity to also reach more families and reduce their burden of, taking, we always hear about transportation and timing as sort of, things that keep people away from mental health services. But acknowledging that it's a heavy lift on both ends to pivot in this way.
Kate and Lauren, there was a question that was posted earlier, a comment or question from Maureen Black. What kind of counseling support is being provided for the workforce of first responders or early childhood mental health consultants to maintain their own resilience?
Yeah, that's a great question. I can talk speak a little bit to the mental health consultation question. So at the Center of Excellence, we've been reaching out and doing a number of interviews with program leaders, mental health consultation program leaders, and ask that very question. So to echo lots of what's been said here today, so we are concerned with families, we're concerned with caregivers, we're also really concerned with our workforce that have all the demands of of challenging jobs on balance with homeschooling and and all the worries of everyone else. So we're definitely hearing a variety of responses coming in. I think one thing that we've heard that seems very consistent is increased access to maybe to a program supervisor or your colleagues having reflective space, whether it's an actual reflective practice session, formal or informal, but really giving those consultants time and space to process with them with their supervisor, within themselves. So that's something that we're hearing about a lot, because it is really challenging. And there's also those folks that are concerned with with ensuring that their jobs are maintained, right? That's something we haven't really talked about yet today on this conversation, but that's a reality for a lot of individuals, is that worry about whether their job will be able to continue if perhaps they can't put in their hours in the way that they're used to. So that's one thing that we have been hearing about, is that reflective space is extraordinarily important.
Well, and certainly that issue is so prime among the childcare providers across the country, which have, don't have the same sort of safety net of a lot of other systems with respect to finances. So there's been a lot of articles and discussions around, what will the workforce look like when this is over, and will they have the capacity to reopen their doors in the same way, or will they have pivoted to something else? And so for mental health consultants whose target is that workforce, you're dealing with the many different levels of stress or focuses of concern in that way. And then the childcare providers that are still open are, daily interacting with families that are identified as most high risk for transmitting this scary, uncertain thing.
We've had this question or comment come up twice now, once from Amanda Futch early on, and more recently from Stephanie Shortman. Amanda asks, we are utilizing our school resource deputies and local mobile response team to make home visits when we're concerned about students. And Stephanie joins and says, any suggestions on how to identify child abuse cases? Reported cases are down since teachers are not reporting and there's no home visits.
Yeah, I will just, I'll just start by saying, I think this is a place we could spend a minute and hear from all of our panelists for different ideas. And this is obviously an enormous concern for lots of different sectors and places. One suggestion that has come across from in the mental health consultation world is, if a mental health consultant's primary setting for service delivery was a childcare setting that is now closed, might there be an opportunity to pivot and work with the local child welfare staff? That's not exactly answering that question about identification, but is an avenue for pivoting to providing support to another workforce that is under extreme stress and really thinking, playing the long game about what the caseloads might look like and what those long-term impacts. That's one thing that we've heard about. Better other panelists to jump in on that really important topic.
I think one thing that's happening in some of the Maryland-based early childhood systems of care is really thinking about how to use consultation and family peer navigation to kind of couple with like Head Start and other places that have a list of families that that they maybe wouldn't have referred to this additional service previously, but are concerned about a one touch per week via a video not being enough to meet the level of stress that the family might be under.
Yeah, I can comment on the question about child abuse reporting, and the person writing in the text box is correct that reports of child abuse are down significantly across the country. Anywhere from 20% to 50% fewer reports of child abuse. Schools apparently account for about 20% of the child abuse reports nationally. So with children not being in school, we would expect that there would be a significant decline. I think primary care practices, pediatricians, offices are also going to be providing a lot of reports, and we're not doing a lot of well-child visits, preferring to do those remotely as well. And I think telehealth in that format probably is less reliable a source of detecting child abuse. So instead, what we are seeing is, as we're doing a lot of telehealth, we're getting windows into families' homes in some ways that we didn't have previously. And so we may come upon issues when we're providing telehealth contact in whatever form or platform you're using. With toddlers or younger children who are ambulatory, they're sometimes taking their smartphone along and showing their house to the folks. And all sorts of things can be seen in the background. All sorts of things can be overheard. And so there are reports about, I heard this really strong argument. There were threats. It sounded like somebody was being hurt. That leading to calls to child abuse hotlines, or seeing drug paraphernalia in the background of a screenshot, in other kinds of ways that we're still trying to capture and have a heightened level of surveillance, because there's no reason to think that child abuse is down. In all likelihood, with the stress that families are under, it may actually be on the rise. And so how do we ensure that we're capturing and supporting these families that are struggling?
I think one other thing that we need to really be clear about is the schools are doing their best to do provide education, virtually. This is new tools, new ways of thinking about it, but it's also new experiences for children, right? So children who there are some who are probably thriving during this time because they're in an environment in which it's quiet, in which they can get their work done. There are others who are probably missing. There's, so it's a new roadmap in terms of what's really happening for families and what's really going on. And it does tell us that we probably need to teach some new skills to the folks who are doing the work virtually, right? To make sure that we help them sort of understand what they should be looking for and where we should be most concerned about. And with families that we're most concerned about, we probably need a lot more touches, not necessarily always the child welfare touch initially, but more touches of people checking in and seeing how they're doing. The isolation is what I think is the most concerning part. And families that are not connecting to schools and not connecting to any of the other community partners are the ones that we need to have highest on our radar in terms of what we're going to do and how we're going to do it now.
Thank you. Kay had a question about financing telehealth. I'm going to get to that in 1 minute, but along these lines, Lisa Curtin is asking all the participants, is anyone else seeing an increase in postpartum depression?
I might extend that question for postpartum and during the prenatal period as well. For those that are pregnant right now, it is a really scary time.
Yeah, so I think I don't know of any data yet, but what we know in the field about what puts people at risk for postpartum depression and anxiety and perinatal depression and anxiety is high-risk pregnancies and not being able to control the outcome. And so many women in their third trimester are now doing virtual OB visits and prepping to be by themselves for delivery. And babies, depending on, again, this varies so much depending on where people are across the nation and what kind of hubs or dosage of COVID their agencies are seeing. So it varies hospital by hospital often, but babies are tested right away. I've seen pictures on Facebook groups of infants with the plastic masks over their heads. And so and then we know the importance of community engagement as being one of the sort of most proactive interventions to reduce postpartum anxiety and depression, and that's not really available now. So certainly, I think the discussions around, I saw one in the chat referencing domestic violence, parental stress, postpartum depression, anxiety, and child abuse are sort of anticipatorily concerning for our cohort of providers.
I see someone put in the chat that a pediatrician has been giving new mothers a postpartum stress assessment, which is great. And I think we are hearing in some places about increased screening, but then of course that always raises the concern about are there enough providers right now? So if a new mom is coming back as showing some symptoms of having some postpartum challenges, is there going to be that opportunity for a warm handoff to a provider? Just navigating all that a new mom is navigating in this particular environment. I want to make sure that we are thinking really critically about how to make those connections. To see that service, that there's some way of getting that service started.
Yeah, I'm seeing. Amrita talking about how to support children who've experienced loss due to COVID-19. And again, like this age group, their understanding of what loss means varies broadly, but there's a number of different, trauma-informed evidence-based practices that would be key to pull upon here, depending on, the child's symptoms and what the family is expressing. We can post some resources related to that.
So Kate, your first blog is part of your Peak series. You did a great job, and you highlighted a Harvard Business article, I think, or a review on the stages of grief. And I know Dr. Balanci is familiar with that as well. I think that resource would be great. Do you want to just go through a little bit of what's in that resource? Kate or Christopher?
Chris, go ahead. I've talked a lot.
The article really was talking about naming what we're experiencing, and the name that this author came up with to most aptly describe what we were going through was grief. And certainly grief if you are someone who has lost a loved one to this disease. But I think grief universally for the loss of our routines, the loss of our sense of safety, the loss of our sense of agency, which also can be associated with anxiety. So whether or not the symptoms become something clinical, I think we're all under a tremendous amount of stress right now. And I think of it more as like a toxic stress model rather than a post-traumatic stress model, because there's no end in sight. It's not a one-off kind of an experience. We're constantly being challenged to figure out how do we filter in all of this information, this noise, the news, the death rates, the flattening the curve, and all of this other information in order to both help protect our own families and ourselves, but also be good caregivers for others. And how do we not have that experience and that information transform the way we remain hopeful? And one of the calls that we had with peer-and-peer supports, there was a lot of conversation about spirituality and the strength that people derive from having a spiritual life. And, it was the high holy days in the Christian church, it was the high holy days in the Jewish tradition, and yet we couldn't be together. So all of the kind of the fabric of our lives are being torn apart. And so this author was really talking about grieving that experience and then trying to find new traditions, trying to find new ways of being connected and being a support to each other, whether it's your family, your neighbors, the children and families that you're working with, and how to adjust or adapt to that new normal. And I think Liz was talking early on in her opening comments about how do we begin to envision what the service delivery system for infant and early childhood is going to look like on the other end of this. Because there are some families who are actually going to prefer these kind of telehealth approaches. There are going to be some staff that actually really like working remotely. Are we going to allow that to continue? Are there things that are actually we'll find are actually working well? So are we starting to capture, even anecdotally, information about what the impact of our adaptive practices are? What are we losing, but maybe what are we gaining? And is there an opportunity to restructure the way we do our work? Going back to kind of my earlier comment about what is your overarching goal for your work with families, and what are the new strategies for still achieving that, given the new limitations that we're working under?
And if I could just add to that, one of the things that I'm really hopeful about, I'm hopeful that we can really be impactful and helpful to parents now of children, of little guys, right? The littles, because this is a real opportunity in which many of them will not really remember the impact of the big scary thing that was going on. If we can do this really well, if we can help parents not be so worried about the big scary thing that's going on. So the more that we can provide help and resources and support for families who are experiencing not just the anxiety of COVID-19, but also the anxiety of the loss of job and the managing to be the teacher and all of that at home, the better we can do that and support families now, the more likely it is that these little guys will actually have a positive experience in the end. I mean, I get to see that with my own 7-year-old great niece, who I think is happier today than she was before because she's at home with her mother. And now we have to worry about what's going to happen later when she goes back to school. But for the time period that we're in, this has been a positive experience and what has allowed them to bond more. And I think we need to use that as an opportunity for change.
Yeah, I feel encouraged by hearing you say that, Liz. And I think as hard as it is for clinicians to think about tracking data during this time, I think it's really important to try to do that in at least a minimal way so that we can, once we crawl out of this, have some data that we can then go to funders on about, you know, here's who did really engage in this, or when we partner with this other agency, here's who we were serving that we weren't before. And so to find meaning in it, we can figure that all out later, but it's hard to look back in the rearview mirror and say, we wish that we were tracking that properly. So try to think about that now.
Well, and also that doing that can, you know, perhaps give you some sense of, you know, of control and ownership and, you know, tracking and figuring out what is and is not working. You know, unfortunately, we will continue to be in this situation for a bit of time. And I've heard lots of different folks talk about how, you know, weeks 1 and 2 felt very different from weeks 2 and 3 and 4, and now we're moving into week 5. I've heard, you know, just anecdotally colleagues saying, you know, that they're now taking some steps to make their home office feel more like a home office. And, you know, so what does that look like when it comes to different issues of with your engaging with children, engaging with families, and just, you know, all that is coming from this. As I mean, I think Dr. said it really well. You know, the fabric of our lives is changing, but with not even every week that goes by, but with every day, you know, what lessons are we learning that is making the next day feel a little bit more manageable?
Great, thank you. We do have a question about charter schools. I'm going to go back to that in one moment and loop back to Kay Johnson's question about financing telehealth therapies. So she says, I'm interested in learning about barriers to financing telehealth therapies, particularly in infant and early childhood mental health via Medicaid. It seems like the states are not always on the ball on this. I know that Michelle Boardman, could you please post, we have a map, a clickable map that you can use on our website that will give you all of the telehealth Medicaid expansion efforts for COVID-19. And we'll post that in the chat box. But I'm wondering what the panel has as far as resources, advice. What have you heard about creative financing for telehealth?
So I know that a lot of states have actually opened up the doors to allow multiple mechanisms of engagement for families, including telephonic at this time. They're usually in temporary orders, executive orders, and that type of thing, but states are moving. So the New Jersey telehealth rules are the ones that I advocated for when I was the assistant commissioner in New Jersey, and they're finally available. And so it's exciting that there's some movement on some of this and that people will be reimbursed for some of the work that they're doing right now.
There's also been a loosening of some of the requirements around Hipaa compliance. And while I still would encourage you, if you're going to invest in this new telehealth technology, to pick one that has Hipaa compliance already built into it, just to save yourself some time. And the Institute also has a resource on this that I'm hoping Michelle can put in the chat box. But there has been a relaxation at the federal level. And it really depends on what state you're in, what's reimbursable through Medicaid. In Massachusetts, they've loosened the rules on that as well. And telephonic, so phone only, you don't necessarily have to have a video component to your video conferencing, is acceptable during the pandemic. I don't know that that will continue after, but for some of these rules that have been relaxed, it's going to be hard for some of the providers or the funders to roll that back. Probably not around Hipaa compliance, because that is a protected and has a reason for being. But if it was just kind of a bureaucracy that just couldn't get on board with the evolving technology, and particularly if it's something that the consumer world really asks for and demands that they continue to have access to, then again, that's going to be one of those shifts that'll be seismic on the other side of this. The earth will shake as a result of this adaptation to new technologies. And that's, again, one of the exciting potential opportunities that comes out of this crisis.
I think similarly, relaxing the restrictions around authorizing for consent for new patients through tele and not in-person signatures as well.
As well as the licensing boards. Licensing boards are addressing this as well. So there's a lot of movement. The states moved really fast to make things available.
Thank you. And again, the clickable map has the Medicaid expansion efforts. Some states have governor's executive orders too. So you can just, and every state is doing something. That's the great news. So you can click on that map. You see something you like, you can be sharing it with folks, leadership in your state. So please take a look at that. We also have a question, and I apologize, I lost in the chat box who it came from. We're looking for insight on how charter schools are handling the progress of a student. How are schools that are not funded by DOE addressing this? They're serving. We serve very few children who attend charter schools. So how are we keeping progress or tracking the progress of children served by charter schools?
Well, I'm not sure why we're calling out charter schools. You know, I think it really depends on the resources of the school and where they are and how they're able to support their students. I think, like all of us, schools were challenged to very quickly adapt to trying to do remote learning. So my agency runs a therapeutic school. We have 120 students as young as kindergarten up to 10th grade. And we already had established Google Calendar technology, Google Classrooms. And we were able to provide all of the students with Chromebooks and have continued to. And in some cases, even been able to provide them with internet service if they didn't already have that in their homes, to try to ensure that as many students as possible are able to access remote learning opportunities. I think it's a little different for the littles. And, you know, one of the things that I'm finding is that kindergarten and first grade teachers or preschool teachers are still trying to kind of force some learning happening. When learning for those littles is often about just how do you kind of be in a space with other kids. And so how do you teach that when you're no longer in a space with other kids? I'd be really interested in what people's thoughts are on that, because I don't know what a substitute for, an enriched preschool environment might look like. And maybe some of you early childhood specialists can chime in there.
It's interesting. My freshly 4-year-old said to me the other day, FaceTime with friends is weird. And I said, yeah, right. That, they're sort of just emerging from this era of parallel play to like actually want to like talk and jointly interact with, but it doesn't translate. I think similarly to the therapist that was talking about, increased meltdowns when they were trying to engage a family for therapy, and the, toddler or preschooler had a hard time just sort of accepting that, right? But there's a lot of great resources online, disseminated through a range of things that just, replicate a story time or a circle time. And I think, more and more, I think this reinforces another key principle of infant mental health, which is that, adults benefit from a lot of these things as well, right? So clear rules, clear routines and structure are all things that are kids benefit from being reinforced in schools. And often that's usually the first time that they really sort of encounter that, like a structure for a day, a ritual for transitions or things like that. But those are certainly small ways that parents can, infuse that into their interactions.
And I see a couple folks are writing in that, there truly is for our very youngest friends, there really is no substitute for actual in-person interaction. And I like the way a couple of you all have chatted in frames to say that they're going to catch up. I think that's another important message that I'm hearing, kind of regardless of the age span. That they will catch up, and as Kate was saying, just to reinforce the importance of infant mental health, again, taking care of ourselves as caregivers, as parents, as educators, as social workers, whatever role it is that we're playing, and many of us are wearing 5 or 6 hats at the same time. That taking care of ourselves and being okay is what our young children are learning and experiencing right now. And that, we should all work, and I just put myself in this category. I have a new 3-year-old, we just need to kind of collectively try and let go some of that angst over, oh my goodness, is my child gonna be ready for kindergarten now because they missed this bit of time? I think the long and short of that is like we'll get through this, and they will be okay. But someone asked kind of another twist on that same question, about children that were having separation issues prior to COVID, and really wondering for some thoughts about when those kids are ready to re-enter, and some considerations and thoughts for right now. So just 2 other places that I just wanted to highlight of having some great resources. The Child Mind Institute has some really great resources out there. Also Child Trends. And just, of course, lots of this depends on the age of the child. But one strategy that I've seen highlighted a few times is to help children with their sense of self-efficacy. So can be as simple as hand washing, helping take, kids love to be helpers. So letting kids really get into helping the family, helping cook meals, maybe learn how to do laundry. My child helped me do laundry for the first time the other day, and she had a great time. So there are some of those kind of practical strategies. So I just wanted to highlight those 2 resources. So when someone's talking about separation issues, that kind of what I hear there is anxiety, which is a theme that lots of us are dealing with now, whether it was an issue before COVID or not. So some of those practical strategies are really helpful.
And Michelle put in the chat the link to Sesame Street, which raised many of us and are still putting out really great things for kids around. And they've had, they have so much stuff that they've previously put out that isn't COVID specific, but is really helpful here, like bubble breathing and, all sorts of relaxation things. So there's the link there. And then somebody talked about using the Positive Solutions for Parents, which is the Cephalopyramid pyramid model parent training, and offering that virtually for parents, which is awesome. So that was Jasmine Davis. So I think,
I'm sorry, Kate. Melissa Cardenas. I'm probably not pronouncing your name correctly, Melissa. I'm sorry. She's the one that posted the question about charter schools. And she does say, for clarification, some charter schools are rigorous and base a promotion to the next grade on assessments and regents. And when those tests are suspended, how are these schools measuring progress so children can actually advance in school? Thank you, Melissa, for clarification. Go ahead, Christopher.
Yeah, I appreciate that clarification. In our state, our standardized exams have been canceled for the year. So those will not be, obviously they can't be given virtually. And I assume that the adjustments will be made onto the testing calendar going forward. So I think there will still be assessments. I saw a report that LA County actually is not going to give out any failing grades. So you will get academic credit for what you've achieved if you continue to do work. But I think as few as 50% of their students are participating in remote learning opportunities. So clearly, this is going to affect communities disproportionately, as everything does. And so adjustments, I think, need to be made to reflect the ability of some families to be able to access remote learning opportunities that are provided.
Yeah, and I think that this is an era where we have to be flexible. And I mean, the idea of somebody who was previously rigid maintaining rigidity for the sake of rigidity doesn't address children and families' needs, you know.
Melissa says I actually pronounced her name correctly. So there, I guess when you marry a German man and you inherit Solzbach, you learn how to pronounce names. So Sherry DeGray brings up a very good point from the lens of perspective of children who are in DCF custody, child welfare. And are folks experiencing stopping of visits? That's what's happened in her county, and it's so hard on the parents and the kids.
And our colleague, Margot Candelaria, chimes in that it's important to remember that the circumstances for our kids are the same throughout the region or state they're in. Everyone's missing time in school, and the system is just going to have to adjust for everyone. So I think that's absolutely true. And I think that is what's happening mostly. Obviously, you know, some communities are better able to adapt to the challenge of both figuring out how to provide services and support to their students with schools being closed, many of which we're already providing kind of enriched online learning opportunities before the pandemic, whereas others are still trying to kind of learn that on the fly. But in terms of the assessment, I think that's correct, that that will have to be a universal response to the crisis we're seeing.
Is anyone able to respond to the DCF question about, or even in the chat box? You all are great in sharing resources with one another. Sherry's just wondering about other people facing no visits with parents when the kids are in DCF custody.
Looking like that is a theme.
Mm-hmm.
Certainly, if the child is in an institutional setting, like a residential treatment setting, I think in those settings, they are following congregate care rules similar to nursing homes, so they're not allowing people to come in from the outside. I think some are becoming very inventive, so whether or not you could say hello through a window. On another chat, there was a story about somebody visiting their grandparent in one of those cherry pickers, so it was actually brought all the way up outside the third floor window of their grandparent's room. So I think the challenges are there for us. What I'm hearing is actually that some foster families are facilitating contact and more comfortable facilitating contact with birth parents in ways that they had previously been uncomfortable with. And actually the remote technology has been facilitating greater connection than might have been there before. So again, I think it's a little bit individualized. And you know, the child welfare workforce, who are also very much frontline workers in this pandemic, are having to figure out how do they do their monthly check-ins with the young people on their caseloads, because most of those are not being allowed to happen in person either, for the same fears that all of us are under. And so, you know, that's requiring also figuring out how do you staff the workforce to have these kinds of remote technologies, including with homes where many of those families don't have the ability to do that.
Did anyone else have anything to add to that? Liz, did you have a perspective?
I actually agree with a lot of what Chris said. I think that we are seeing places in which children are not able to visit their parents, and I think that's probably going to continue as long as the distancing rules are in place. Really to keep both safe at this time. So we're just going to be facing some challenges around how to bridge that distance using technology whenever possible, and supporting our partners in child welfare as they're trying to really make the best decisions they can in the day-to-day.
Yeah. And Jessica Latora in the chat box recommends her administration on courts. The Foster Care Improvement Project has put out some guidance. So we encourage you to check in with your state courts as well. So Barbara Dominic has a question. Anyone providing tech support to caretakers who may be uncomfortable with technology needed for their child's education? Talking specifically about grandparents and grandchildren.
I'm glad you bring that up as a question, because in our early childhood learning community, we've had a lot of sessions on grandparent-led families, and we know that the statistics look like that there are just so many grandparents out there raising grandchildren, and so that's an excellent question. Does anyone on our panel have some resources at the ready for that?
I don't, but I would certainly think Generations United, which has been a big partner with Lauren and I on that issue, would be the place to look, as well as Fredla.
Great. So we're hitting a point, we're about to wrap up. I wonder if each of the presenters on our panel would like to say a few wrap-up comments, next step suggestions, inspiration for the world, and then we'll say goodbye for today's discussion. Look forward to connecting with all of you again. Kate and Lauren, I don't know if you want to give a pitch for your learning community. That would be awesome. So why don't we start with Dr. Belancy? We'll go with Liz, then Lauren, then Kate. Christopher, all you.
Okay, thank you. So first, I would just say that when I can't figure out how to use a technology, I always go to my nephew or my niece. So the youngsters will lead us on this one. Maybe not the littles, but if they've got older siblings, they're going to be able to figure out the technology much faster than their grandparents, certainly. Second is, I'm surprised it took us this long to get to the racial disparities and how this pandemic is reifying and just reminding us once again that the most vulnerable communities are going to be disproportionately impacted. And we're seeing that in all the major cities where the death rates are twice or more for people of color. And so it's devastating, once again, to be faced with the disparities that are probably tied to poverty, what forms of work individuals are in, high density population areas where it's hard to socially distance, underlying health concerns, et cetera, et cetera. So I think it's really important that we bring that part of the conversation in and think about how this is shining a bright light on those disparities. And now it's up to us on what we do about that.
So I couldn't agree more in that. That's part of the work moving forward is we really need to make sure that we address the disparity that's happening. Certainly it's a huge issue across the country, a big issue in my own state here in New Jersey, in which we're going to really need to come up with solutions in which we address it. I think that with crisis comes opportunity, and this is an opportunity to move all of those conversations forward, paying attention to how we got here in terms of what were the drivers and what tools do we need to move forward are just really important parts of the work. I do think that the opportunities that have been created include the use of virtual technology, include the engagement strategies that have to be so, we have to be so good at engaging families and keeping them at our tables that those tools are going to be really important moving forward. But in this time, it's also important for us to pay attention to who we're missing and who is struggling and who we're not hearing from. And those are the places in which we need to turn some attention to now. And we need to plan for the future. And planning for the future means that we need to recognize that there will be increases in all of the needs of youth and families as we try to move back, including new populations of folks, like the folks who are on the front line, like the doctors and the nurses whose children are at home, and how they're being impacted by that, by the folks who have lost loved ones during this period of time. And so we really need to be thoughtful about all of that and recognize that we have a ton of work to do moving forward. And so thank you for all the work that you're doing now. I hope you get a little bit of rest during this period of time because we have a lot of work before us.
go next. So yeah, so just to wrap up, I think everyone has been so generous in sharing resources and stories and coming forth with questions and keeping this conversation moving. I am filled with hope just by the number of individuals that are on this webinar today that are taking an hour out of your extremely busy schedules to connect with us and to share resources. I am so motivated by that. And you know, a colleague gave a nice metaphor the other day that's resonated with me. You know, that we are all in the same storm but different boats. And I think that, you know, that this issue of racial disparities and child welfare and all the different systemic pieces that have been brought out in our conversations today, domestic violence, anxiety, you name it. We didn't even get to substance use, which has been a really prominent theme in our learning community. You know, there are so many different impacts, and we have a lot of work left to do. But I do think we have every reason to be hopeful, and you know, in this early childhood world, I think that's why so many of us are drawn to it. Is that idea of hope and resilience that we see in our young friends. So I will turn it to Kate, but yeah, I just want to express my thanks and gratitude to you all.
Yeah, I'm not an easy three to follow, and I think you guys have said a lot of things that have centered me during this conversation. And I think a lot of this is happening to everyone in every community across the globe right now, but part of the work that brings us into infant mental health, right? We're already, you know, trained in our way to be adaptive, right? I mean, early childhood educators and therapists are, you know, you plan and then you adjust based on what's happening in the room and what the child needs at the time. And we're already trained to think dyadically and within sort of the scope of systems, because we don't think about kids under 5 operating themselves, right? And so I think a lot of this, we should collectively lean on our strengths to be adaptive in this time and to track it so that we can make meaningful change once we're all back into whatever stage this ends.
Well,
so Lauren and I do run.
Yes, please. Thank you. Go.
a national webinar that again has ranged on a number of topics just relevant to our collective work. We will send that out with a link to a whole website with a library of pre-recorded webinars and related resources on everything from systems design to trauma to financing. We have one this Thursday, I think at 1 o'clock, Lauren, in partnership with FREDLA and the National Family Advocacy Agencies around talking with families around trauma. That we'll send that link as well.
Great. Thank you, everyone. On behalf of the Institute and the TA Network, I want to thank our presenters, and I want to thank all 673 of you participating with us today. This chat box was extremely informative for all of us. We will make sure that you all get the recording as well as all of the resources shared in the chat box. And again, this has been very much a conversation thanks to you. You've shown us that truly together we are stronger in creating forward-looking solutions that meet the challenges of today while building a brighter tomorrow. So thank you, everybody. We hope to see you again, and we'll make sure you know about future conversations. Take care, and take care of yourselves while you're taking care of others.